go ahead and get started. Our first speaker is Maegan Henry. Maegan comes to us from Bluefield, Virginia area, and she is a biology major, and it's her desire to teach high school biology when she finishes, and preferably in the inner city. I think she is in line for sainthood for that. All right, but she's going to speak to us today about rhabdomyolysis, and whether sports or medically induced causes the most damage to the human body. All right, let's welcome Maegan.
So, as Dr. Pickard said before, my topic will be on rhabdomyolysis, whether sport or medically induced causes the most harm to the body. So here's a general outline of how I will proceed through my presentation today. I will begin with an introduction, the hypothesis, 2 case studies, the conclusion, discrepancies, and my revised hypothesis. So what exactly is rhabdomyolysis? So it's basically when your skeletal muscles are broken down and they're released into your bloodstream, which is very toxic. So there are several causes of rhabdomyolysis. Crush syndrome, which is actually associated with a car crash, can induce rhabdomyolysis. Excessive muscle activity, that is meant to be by like athletes, or it's mostly found in athletes and militant recruits. Genetic diseases such as muscle dystrophy and sickle cell anemia cause a person to be more susceptible to rhabdomyolysis. Temperature extremes, whether it's extremely hot or extremely cold, causes rhabdomyolysis as well. It's usually associated with extreme hot temperatures. Toxins, which are usually found in snake bites or spider bites, are also known to induce rhabdomyolysis. Infections, whether it's a viral or bacteria infections, also induces rhabdomyolysis. And drugs. When I say drugs, I mean specifically for this study that we're doing today, statins. And statins are like Lipitor, which are used for lowering your cholesterol. So as I stated before, the specific cholesterol that statins try to prevent are the LDLs. And statins inhibit the HMG-CoA reductase in the mevalonate pathway. So part of the products from this pathway are cholesterol. So the statin goes in and stops it from the process from happening. So it also induces necrosis, which is the death of body tissues, because there isn't sufficient blood flow going through the body. The symptoms. Symptoms of rhabdo are red-colored urine, a decrease in urine, severe leg cramps, swollen and weakened muscles, nausea, vomiting, and dehydration. So pictured here is a biopsy of a muscle cell with rhabdomyolysis. This is the part of the cell that has been lysed, and this part of the cell hasn't had rhabdomyolysis yet. So when it comes to diagnosing rhabdomyolysis, a blood test or a urine test is given. So when they check in your blood test, they check your myoglobin, your creatine kinase, your calcium, and your potassium. Myoglobin is usually found strictly in your muscles. However, it's found in minute amounts in your blood. During a urine test, they strictly check for myoglobin levels because it's excreted through your kidneys. So pictured here is a sample of an individual who actually has rhabdomyolysis, hence the color of the urine. So with rhabdomyolysis, there are many complications that come with it. Some people their cases can be so severe that they actually develop acute kidney failure, compartment syndrome, abnormal electrolytes, and acidosis. So as you can see here, here's a damaged muscle, and in your muscles you have your myoglobin, and when the muscle is damaged, it excretes it into the bloodstream. So the typical treatment. Most people are hospitalized, and they are given fluids to help rehydrate them. If the person is actually medically induced with a statin, they stop the person from taking the statin. And dialysis is also used, and it helps cleanse the body of the toxins as well. So this leads me to my hypothesis. So statin-induced rhabdomyolysis will cause the most effect on the body because of the time it takes the CK levels, which is creatinine kinase again, and the myoglobin levels to return to normal. So the two case studies that I reviewed are exertional rhabdomyolysis in a collegiate athlete after cold water immersion. It was completed by Alve et al. In 2012. The second case study was rhabdomyolysis in an elderly multi-treated patient after statin withdrawal, and it was completed by Gianni et al. In 2013. So this first case study, the rhabdo was actually found on a 19-year-old African-American collegiate athlete. He participated in football. He was diagnosed during the preseason part of his football season. It was actually the third day. So the temperature on the third day of his preseason conditioning, it started at 75 degrees and rose to 82 degrees as well. So it was mandated by the coaches that he submerge himself up to his navel in an ice bath, and ice bath helped the athletes recover. So prior to getting into the ice bath, he didn't complain of any muscle cramps or anything. However, when he came up from the water, he began to have muscle cramps in his quadriceps and hamstrings. So the athletic trainers started stretching and massaging him to get out the cramps. However, they still couldn't get it out, and they began to give him Gatorade, which I believe it's Gatorade 3. It has the most electrolytes. It's not really good. But anyways, the cramps persisted, so they called the team physician, and the team physician met him at the hospital. So when he was at the hospital, they went over a history of his general background, medical background. They also gave him a physical exam to check whether he was in cardiorespiratory distress, and they also administered a blood and urine test. They also checked the young athlete for sickle cell anemia. Sickle cell is mostly found in African Americans, so if he had sickle cell, that could be a cause that made him have rhabdo even more. However, his test came back negative. So during his stay over the hospital, they administered several blood tests, and in the first day, his creatine kinase level was 2,545, which is 13 times the normal amount of CK found in the blood cells. And his myoglobin level was 499, which is also outside of the normal range, which is between 0 and 149. So he was delivered a second blood test here, and his CK levels actually decreased, but his myoglobin levels increased. Then a third blood test was administered, and his CK levels actually increased while his myoglobin levels decreased. This hadn't been documented before in rhabdo, so that kind of alerted the doctors as well. So the treatment plan for this athlete, they gave him IVs to help hydrate him. The doctor also put him on a diet to make sure he's eating properly so that he could fuel his muscles. And they gave him a water regimen as well. He went back to football practice or whatnot. However, he wasn't allowed to compete in the full contact sport. So he had monitored activities, so he was only allowed to bike and swim. So the athletic trainers had to watch his activities to make sure no symptoms of rhabdo came up again. So after that, the athletic trainers had to create a follow-up appointment with the doctor. So during the follow-up visits, they measured his creatine kinase levels again, and his levels had actually decreased. However, for some odd reason, they don't understand why, but his CK levels actually increased, and then they began to see a downward trend after that. His myoglobin levels decreased, but at the end, they've seen a slight increase right here towards the end in his myoglobin levels. That isn't understood either. So since his myoglobin levels were close to normal, which is between 0 and 149, he was released to go back to football. So it took this athlete 6 weeks to return to full contact sports. This is definitely rare because it usually takes 15 weeks for most individuals to go back to their sport. The unique case, it was unique because it wasn't seen that the CK levels would increase and then the myoglobin levels would increase as well. It's usually just consistent. So due to discrepancies more research is needed to identify the signals and factors of rhabdo in this specific case. The second case study was completed by Gianni et al. It took a 72-year-old patient. He had heart disease, high cholesterol, and high triglycerides. So at the age of 58, he was put on a Lipitor regimen to help lower his cholesterol levels. Around the age of 69, he was diagnosed with rectal cancer. And shortly after that, he began to show signs of schizophrenia. So they prescribed him with an antipsychotic and antidepressant. Antipsychotics and antidepressants are also known to induce rhabdomyolysis as well. So knowing that Lipitor or statins and antipsychotics and antidepressants cause rhabdomyolysis, they administered blood tests regularly to make sure his CK levels were okay. So in July 2011, he began to feel chest pains, so they administered him another statin to take as well. So in September 2011, his CK levels began to rise, so the doctors immediately took him off the Lipitor. It's not known why the doctors decided to take him off the Lipitor, because it could have been a drug-to-drug interaction that caused the rise in his CK levels. So as time progressed, they continued to check his CK levels, and his CK levels in February rose to 787, and then they seen an increase as well in May, and his myoglobin levels were at 670. So in June 2012, the 72-year-old man started feeling muscle weaknesses and pains. So they rushed him to the clinic, and in the clinic they tested his blood levels again, and they found that his CK levels was at 7,439, his myoglobin levels were at 4,483, and his total cholesterol was at 267. And the normal range for your cholesterol to be is around 200. So since he complained of muscle weaknesses in his legs, they took a biopsy on his vastus lateralis. So pictured here is the biopsy that they took. On the biopsy, they used the human leukocyte antigen, HLA, and the avidin biotin complex, which is ABC. So the ABC is part of the antibody that shows where HLA attached to the antigen. So this is right here. That's the dark shaded part. And it showed the leukocyte where it needed to come in and begin phagocytosis to help rid the body of the cells that are foreign to it. Sorry about that. So, seeing that this picture, it says that there's no inflammation and no spreading. Since no inflammation and spreading was seen, that means that it was definitely statin-induced and it wasn't a disease that actually caused the rhabdomyolysis to be shown. Because if it actually was disease, more of the muscle cells would actually have had rhabdomyolysis. So the treatment for the elderly man, the doctors administered him to stop taking the medication that stopped the chest pains. They gave him an IV for a week, and 21 days after, his muscle strength returned, and they seen normal levels in his cholesterol, CK, and myoglobin. The doctors also prescribed him Crestor to make sure his CK levels stayed low as well. So, part of the discussion. His CK levels actually didn't begin to rise until he was administered the antidepressant and antipsychotic. So the drug-to-drug, like I stated before, the drug-to-drug interaction between the antipsychotic and the antidepressant with Lipitor could have induced rhabdomyolysis. So by conclusion, the CK level in the elderly man was actually higher than that of the athlete, and it also took the elderly man a longer time to heal from rhabdomyolysis, which only suggests that statin-induced causes the most harm to the body. However, that's with a lot of discrepancies. So the discrepancies are, does age and health play a factor? The statin-induced patient was 72 years old, and the athlete was 19 years old. And the athlete recovered at a much faster time than that of the elderly patient. And the diagnosis, not much is known about rhabdo, so the doctors or the medical community needs to come together on what criteria it takes to diagnose a rhabdomyolysis in a patient. Typically, rhabdomyolysis the patient is diagnosed with rhabdomyolysis when his CK levels are 5 to 10 times higher than the normal range. So from there, I had to revise my hypothesis. So I said, although the statin-induced patient showed higher levels of CK than the athlete with exertional rhabdomyolysis, age and health will play a vital role in the effects that it has on the body. Are there any questions? Yes.
Let's go back sort of to one of your initial statements where you said it was not a disease.
Okay.
Is it a condition? And what variety of causes is there for rhabdomyolysis?
Okay. Sorry. So it's a condition that is, well, it's an adverse condition. It's a side effect when it's statin-induced, but it's also like a disease from my understanding, because it was a disease. Could you rephrase that question so maybe I can
You said it was not caused by a disease in the elderly man. So is it something that can happen to the body? Is it bacterial or viral?
Well,
or
when
is
I
it
say
none of the above?
Okay, it's neither. The reason why it's not a disease, if the man had a disease, that meant that it would have been spreading throughout the rest of the muscles. However, if you have a genetic disease, such as like muscle dystrophy, it causes a person to get rhabdomyolysis and it spreads much faster because there's already like a weakness in the muscles.
So you don't really know what the cause is that what you're saying?
Right.
Okay. Now, in your first case, it didn't sound like the conditions under which the athlete was working out were very extreme. I mean, the temperatures were fairly low compared to a normal summertime workout, not like South Florida would be or someplace like that.
Right.
So why did they think that would have affected him but not his fellow athletes? Do you have any feeling there?
It really didn't say. It just showed. Currently, they just use that if your CK levels are 5 to 10 times higher than the normal range, then they usually say that that person has rhabdo already. And it's not understood. Like, they don't understand the pathway that causes rhabdomyolysis fully. Yes?
So in the first study, after the athlete was treated with the ion water, they kind of like cured him or whatever maybe?
Right, because dehydration is also associated with it.
So like, if say he doesn't stay hydrated, can it come back again?
It would last longer because the water is actually like helping rid the body of the foreign proteins or the destructive muscle cells. So the bad thing about it, like staying in there, would be that it blocks your renal tubes, so your body wouldn't be able to fully flush it out of your system. Does that answer your question?
So that's the only treatment that they know of is giving you IV, not
Right.
any kind of medicine, right?
Pretty much.
Skeletal muscle cells don't grow back after they've been destroyed usually. Did they kind of estimate what percentage of like muscle function he lost from
They did not.
that? Okay. I mean, you said you resumed playing sports again, so I guess it wasn't too bad, but I didn't know if there was something like that could be very serious where you could lose complete function. Did they?
It didn't say. Now there's it's kind of like on a continuum that rhabdo. There's some that's really like minute that doesn't cause as much harm on the body. However, like exertional causes a lot of harm on the body, but it doesn't go into the actual percentages of how much muscle he lost. Yes.
What dosage of Lipitor were you taking?
You know, I think it was like 20 milligrams, but I could be wrong.
I was wondering if it was a low or high.
Yes.
Do you know if this is related to like MS or other diseases that are kind of like that?
Isn't MS, correct me if I'm wrong, isn't it a muscle disease, right? Mm-hmm. So that would make him more susceptible, the person, to having rhabdo.
Right.
But I'm not for sure if that answers your question.
Yeah.
Yes.
Is it gender specific, because both cases were male?
In my studies, I did not see that it was gender specific. However, I guess from assuming that most contact sports, because that's usually what rhabdo is associated with, like crush syndrome as well, it would be more with males.